Singapore's medical inflation hits an Asia-Pacific leading 16.9%, driving a drastic private insurance overhaul that forces policyholders to absorb higher bills. To explain the shifting dynamics, we have Dr. Warren Ong of Cigna Healthcare and Associate Professor Tan Yang Kun of Singapore General Hospital. Welcome, Dr. Warren and Yang Kun. So, is Singapore's 16.9% medical inflation a warning sign that the current healthcare financing model is becoming unsustainable?
Yes, indeed. I think any healthcare expenses growth beyond a nation's GDP growth, clearly, at some point in time, you will reach an inflection point. We certainly can't afford to grow beyond what our nation can afford as a whole.
I believe that rising medical inflation is really a sign that our healthcare and financing model needs to evolve alongside our current healthcare needs to ensure that we continue delivering quality healthcare to our community. This really then means stronger collaboration across the ecosystem, the healthcare providers, insurers, employers, and even policymakers to improve cost sustainability, aligning accountability towards care that prioritizes outcomes for an individual.
But just building on that, what further reforms could policymakers consider if medical inflation remains above regional averages through 2027?
One policy change that we're certainly trying to put in place is to how do you encourage and steer our population to consume healthcare services in a way that is responsible, that is reasonable. I think the practice of having zero co-payment certainly would not be consistent with that kind of behavior we want to see. We certainly feel that when everyone has a little bit at stake, it would encourage a more reasonable consumption. It will allow the health system to cope with the increased demand due to the aging population, and we grow gradually with the needs of the nation.
Yeah, I echo Prof. Tan's comments. I think it's important that we look at the sustainability as a whole. So I think all players have a responsibility in ensuring that the cost sustainability is maintained. So that then really includes insurers playing their part, policymakers creating policies that supports cost sustainability, as well as providers to then be able to work within the ecosystem to ensure affordability for all in time to come.
Now, speaking of reforms, on the insurers' side, could insurers introduce additional cost-sharing measures if the April changes fail to slow claims growth?
Perhaps for the insurers to suggest, but I think ultimately the affordability is a very strong lever to change health-seeking behaviors. We have to find a balance. It is important that those who can afford private healthcare and who perhaps want to enjoy more convenience, more customized services, be able to do so at a rate that is affordable. If we create a ecosystem that is so stringent and so tight that nobody can afford private healthcare, what then would happen would be that the whole population will shift their health service needs into the public sector.
Now, going to the patient side, how will the higher co-payment cap change patient behavior between private and public healthcare?
Whenever there's a price change or policy change, as shown in the recent changes by Ministry of Health, I think it's reasonable to expect some change in patient behavior. As to whether that affects the private or public, I think it's not clear at this point in time, but we do expect some changes as well. So I think on our case at Cigna Healthcare, I think for us, we do ensure that our policyholders have flexibility and choice for the insurance coverage and options. So I think that's something that we put forth to ensure the options for our customers.
I think it is too early to see what the mega trend would be. We do see some shift. We do see an increased number of patients coming to the public sector. I do want to make a point that patient can or population can choose to come to public sector as a private patient, or they can also come to public hospital as a subsidized patient. When they come to the public sector as a private patient, there is an infusion of financial resources that come in from the private sector, i.e. the payer, in this case, the insurance company.
But let's say if we were to make a list of things to watch out for, what early signs would indicate patients are shifting away from private hospitals faster than expected?
I think we need to look at our data, and we're tracking our data carefully. We're certainly seeing more patients coming to the public sector, but truth be told, we are expecting that there will be more patients coming to public sector because of a very rapidly aging population. What is not easy to tell, I think it's really too short a runway for us to assess this properly. How much of this is due to the policy change that is taken effect in April? I don't think we have a very clear idea where this is going yet.
I think from an insurance lens, echo the same sentiments with Prof. Tan. I don't think it's possible for us to tell the trends at this point in time. It's only been about 2 months. But a few leading indicators that can suggest whether certain patterns of behavior has changed would be really to look at whether our patients that are already on certain plans, when I speak about from the insurance lens, it's really on the integrated shield players. But then they do see a trend of insured clients and members actually going to private, not just for subsidized care, but for private care as well. I think with that, you'll be able to use that as a potential indicator to see whether the policies in place have actually adjusted the behavior on an individual level.
And because we highly value your thoughts as experts on the topic, if you were to make recommendations, what should stakeholders do next to keep healthcare affordable without overloading the public system?
I think, like what Prof. Tan has mentioned earlier, I think all parties need to play their part. I think insurers ourselves, we have to see the affordability aspect and see how we can manage the portfolio better. We have to work with healthcare providers actively, looking at not just volume of care, but rather quality and value of healthcare. And I think it's a very common topic right now when we speak about value-based healthcare, not just in the public sector, but in the private sector as well. And the last of all is individuals themselves, the patients as well as employers, when they provide health insurance for their workforce. We all need to work closer in collaboration to then be able to bring quality to our customers and patients, and not just looking at the high volume of healthcare utilization as a means to an end.
So if I can just dovetail that conversation, I think at the policy level, it is important to create policy that is allow the population to choose the tier of services they would like to enjoy. Hence, depending on your affordability, you would choose the tier of services that you want. I think for the insurance provider, as they have always been doing, which is to provide fair, reasonable price for the value that is delivered. Again, you want a policy to be flexible, to cater to different segments of the population depending on their socio-economic background. From the health system point of view, we will continue to strive towards the best possible value-based care. We have always, certainly in the public sector, thrive on efficiency.
And if you could just let me echo the common workarounds, can you confirm this? Before public hospitals face greater strain, could AI, preventive care, and new care models reduce cost pressures?
In terms of AI, both on the healthcare space as well as the insurance space, I think there's been a lot of things going on in the works, both to assist in operational efficiency as well as to help in a way delivering care to our patients. I think that's the first point. In terms of other new models of care, I think in terms of Signal, we actually have derived a value-based healthcare partnership with iExchange, one of the arms of IHH, to try to shift the focus from volume to value-based care. And I think as an insurer, we are one of the first to drive this to see how we can provide more value to our customers and members. So I think there are various modalities that would definitely support our endeavor for cost sustainability for healthcare in Singapore.
The short answer is that AI has got tremendous potential in healthcare and health delivery. From the part of health system, we look at AI contributing in these three major areas. It is smart treatment, it is about smart services, it is also about smart operations. I think key to this is AI can potentially convert a episodic care to a continuous seamless care. It can convert reactionary care to a preventive care. It can also convert a very truncated care into one that is seamless for the patients. And I also want to say that there are a lot of AI utilities in promoting self-care and preventing illness.
Thank you so much for sharing your thoughts, Dr. Warren and Yang Kyun. Hope you can both join us again soon.
Thank you.
Thank you.
Once again, those were Dr. Warren Ong, Head of Clinical for Cigna Healthcare Asia Pacific, and Associate Professor Tan Yang Kyun, and Chief Executive Officer at the Singapore General Hospital. For more news, visit sbr.com.sg.